great question to ask, Ms. Wilson. And I really wanted to just backtrack because I don't have your bio to read.
Oh,
so can we hear a little bit about your background?
Sure. All right. My name is Jay. I am the founder of Melanated Moms. We are a community centered women empowerment organization that primarily focuses on maternal health equity through community engagement, advocacy, and entrepreneurship opportunities. We started about 5 years ago, just out of the need of looking for community myself. I am a mom of 2 young girls, and at the time I was going through a divorce, and I wanted to really find a way to connect with other moms and women and birthing people who look like me, who can understand the different transitions I was going through. Prior to starting my organization, I am a nurse. I've been a community health nurse for almost 20 years. I've worked in New York City for the majority of my career with the LGBT community. I've also worked with different areas of marginalized patients, including transient youth, homeless population, different moms at different stages of their lives, substance abuse, and all different areas like that. I've also been very involved with advocacy work on the local, state, and federal level, from New York State and for New Jersey. Did a whole bunch of other things too. I'm an author. I actually wrote a book called Find Your Roar, which we turned into an advocacy training. And to date, we've trained over 2,000 people nationally and internationally to learn how to find their personal story, how to use their personal stories to talk to legislators and to provoke change. So it's been a really amazing ride, just kind of being a part of all these things. Every day I wake up and I'm like, how did I get here? Who brought me here? I'm just grateful that I continue to do something that I love so much every day. As I said, I have 2 young girls. My girls are 11 and 14. Well, I guess they're big girls. And my personal commitment and connection to this work through my birthing story is I'm a 4-time survivor of preeclampsia. And going through that experience, I lost 2 children before giving birth to my first live child. And in the moment, I didn't know that those experiences would fuel what I'm doing now. I just thought that they were personal experiences that I went through. But through forming Melanated Moms and having conversations like this and connecting with communities all over, I learned that the issue that I had, unfortunately, is very common, but it doesn't have to stay that way. It changes by having these conversations and by normalizing giving support where it's needed. And I love to say the phrase, find a resource, be a resource. So when I can't find it, or when I can, I love to pass it on to the next person and then teach others how to be that same resource for other people.
That's wonderful. Thank you for all your work, and I can't wait to see where your organizations go.
Thank you.
To revisit your question. So yes, I have a bonus daughter who's 15 years old, and then I have a daughter who's 7, and actually have a 1-year-old son. So this is a very personal journey, and the postpartum part is not that far removed from my own personal experience. Yeah. But I'm coupling the personal experiences that I've had with my own family and friends, and then having 2 children at 2 different kind of points in my life, and really appreciating, doing things that maybe a little bit differently, and things that I definitely kind of want to give hints to other moms and families, as well as focusing on the medicine side and thinking, hey, why can't we in the medical field, be it the nurse, the midwife, the doula, the doctor, get together and talk about some of these things that exist during pregnancy and especially after, to sort of improve outcomes. So I'm blessed in that I feel like I found my calling, my message, and then I really find passion in like just talking to everyone who comes from everywhere. One of the benefits of being in the healthcare field is you meet so many people from so many walks of life. And I'm pulling from so many different people, ages, cultures, experiences, and I'm taking that information and trying to find the best that benefits us all, regardless of who we love, where we come from, where we live, all those things, because there's so many things that are very universal in our experiences as human beings on this planet. At the end of the day, we want to be safe and we want our kids to be safe. And if we focus on that as a community, be it in birth and other aspects of our lives, I feel like we all will have a better outcome. So it's definitely some of the feelings that I have, and I'm using this as an avenue to do that.
That's amazing. And it's so great when you're able to reflect on how it also touches your own personal situation, your own experiences. I know when I was in nursing, that was one of the things I used to love to do, is really be able to connect with the patient so that you humanize the experiences that they're having, right? So thank you for that. Thank you. So our first question is, what is a fourth trimester plan, and why is it important for new parents to create one?
So I think we'll take it. So what we do in medicine, and I guess maybe from a historical perspective as well, pregnancy is pretty much divided into 3 trimesters. The first trimester being kind of 0 to 14 weeks around. Second is like 14 to 28 weeks. And then third trimester is considered 32 weeks till you deliver. And then at some point in time, the medical community got together and really started to actually study maternal death. And unfortunately, maternal death is characterized as any death that occurs within 12 months of giving birth, whether it was birth related or you got hit by a car that didn't have anything to do with pregnancy, it still counts as a maternal death. So then they broke that down. Okay, these women died either at giving birth or 12 months after birth. And they found that 1/3 of deaths occurred after the woman had already given birth. So then that was kind of like a light bulb, like, hey, what is happening? Why are these women dying after they give birth? And then they further looked into the numbers. And if you are someone of African descent or come from what we call an ethnic background, you were 3 times more likely to die living in the same city, town, state as someone else who's not of this ethnic background. So then the conversation really started to spiral into, look, these are deaths that, and like one out of these 3 deaths was deemed preventable from a medical standpoint. So then we kind of, as a culture, mostly talking about like the American College of OBGYN, said, look, we're going to recognize the 12 weeks after birth as the 4th trimester, in a time where we as the healthcare community really still need to engage in families and women who've had young children. And we can't put it all on the pediatricians, because the mom is not the pediatrician's patient to really start reconnecting with mom. And the rates for the postpartum visit are abysmal. They're like 60% of women don't come back for their postpartum visit. Mainly because it's 6 weeks. At 6 weeks, you've been through it all. Like, you've done it. You survived to some extent, and you have somewhat of a handle, or, so that was some of the points that we are addressing in the medical field. So the point of the first trimester was to give patients a plan. Say, you're in the 4th trimester, you need a plan. Just like you had a plan for your birthing plan, right? Bag was packed. There was food in the fridge. Somebody was going to watch the other little baby. The neighbor knew what was going on. So now we have to still implement some of those tactics in the 4th trimester.
Awesome. Thank you.
In order to create better outcomes.
Absolutely. Oh, sorry. I think that's something that a lot of people aren't as aware of, right?
No.
When we think of pregnancy, it's usually just those 3, right? But particularly around like community health, we've seen that the 4th trimester, yes, it is clinically those first 12 weeks, but it's very extended, right? So we know, as we're seeing issues with postpartum parents, a lot of the issues are coming up between day 7 and day 42, right? But even after that, you may have other postpartum issues. I was just having a conversation with someone the other day about how I've been seeing such an increase in postpartum preeclampsia. And particularly it's been, that's one of the, so preeclampsia is a high blood pressure disorder that typically arrives during pregnancy. It's categorized by several high blood pressure readings, swelling in the hands, legs, and face, protein in the urine, and headaches, some other symptoms, right? But the official diagnosis of it or cure for it is actually birth, right? Or it used to be birth.
Right. So the treatment, the only treatment is actually delivery of the placenta. Delivering the placenta is the curative method for treatment of preeclampsia. That being said, how do you deliver the placenta without delivering the baby? You cannot do that.
Right. But now we're seeing more and more women who are developing preeclampsia postpartum. So they've already given birth to their baby, right? So how can we pay more attention to when we're seeing these new, or I guess I won't say this new, these revised versions
be aware.
Yeah.
So postpartum preeclampsia, in the sense that from a disease process, your body, your baby's gone, but your body doesn't quite process that, right? So your hormone levels, all the adrenaline, all the fluid shifts in your body, they're still occurring as if you are pregnant, but your body has to kind of reset. So in that reset process, you can have this reflux in your blood pressure, even though, yes, technically your placenta is gone, but all the levels in your body have not returned back to normal. So we talk about this in your 4th trimester plan as things that everyone in your village, and I definitely want to emphasize your village. This is your group of people who you trust with your family and your health to look after you after birth. And it does not have to be anybody who you think should be in your village, right? Not everybody has a healthy relationship with their parents. And, we respect that. So it really needs to be someone who you feel will protect you and your family, look out for your best interest, as well as help you in a way that you need help, which is very specific thing. Because, people say, I want to help you, but their help may not be the help that you need. So part of this finding who's in your village, your 4th trimester plan, is finding your voice, what kind of help you need and how you can convey that to that group of people. That being said, there's warning signs in the 4th trimester that you should specifically look out. And I know Birthing the Magic Collaborative put some of this information on their website, so please check their website out for that. Things that we're talking about are extreme headaches. You're tired, everybody's tired, babies don't care what time of day it is, I'm awake, wake up everybody else. So with that being said, we're talking about extreme headaches where you cannot see, you lay down, you took a Tylenol, it didn't get better, you cannot focus. And it could be related to sleep deprivation, but either way, you've crossed the line. Any condition you have that is not relieved to some extent by rest, hydration, basic Tylenol, if you can take that, basic ibuprofen, and you've done all the supportive things, that's when you need to call your doctor's office, your doula, your midwife, whomever you have. And it is important for you as an individual being part of your village. Your healthcare team is still part of your village as best as it can be. Even if I know I don't want to bring this up, you did not have the birth experience that you desired or something you feel was not adequately done, please do not give up on your team who took care of you, because unfortunately, then you'll get lost in this healthcare system and no one will claim you as their patient because they don't know you or who you are. And they may not listen to your symptoms the way they should because they're kind of like, oh, well, you're not really our patient. You should speak to the person's team who took care of you. Just in this immediate period, I encourage you to continue to reach out for whatever it is. So in your village, these are things that you should look at. And everyone who's taking care of you in your pregnancy, your question is, if there is an emergency and it is after 5 p.m., what number do I call? That is a conversation. First of all, they should tell you that on like the first visit. But if they don't, that needs to be established in your postpartum, 3rd trimester conversation. What number do I call? What is the protocol? What office? What line? Who do you contact? Who do you get to talk to? And sometimes even insurance plans will have nurses you can talk to after hours. Now, these may not be nurses that deal with women's health or pregnancy, but at least they're still nurses or healthcare workers. They can still guide you.
Right. That's so helpful. And I feel like you answered the next 2 questions, but that's still good.
I do that a lot. Sorry.
No, it's totally fine. It's totally fine. I want this to be a good open conversation and just to flow, right? So you've explained a lot of the benefits of this, right? But understanding pulling together, and you kind of touched on this already, but like pulling together your community, your village, your team of people, who those people could be, and what types of roles to give them can really be critical when it comes to having the right postpartum support, right? So do you have any recommendations on how people can identify the best people to be a part of their village?
Right. So nowadays people, you live here, cousins live here, everyone, I have friends who have, family abroad. So, it's beneficial to have support system of those you know and love. Definitely now we have this benefit of webinars and Zooms and all these things we didn't have. Like even like 10 years ago, we didn't use this technology the way that we did now. So I definitely think you should use that. There's even your healthcare provider might even offer some sort of Zoom kind of situation or telehealth in some way, even the phone or the camera. I really encourage all healthcare workers out there to check in with their patient 1 week, at least within the week after they leave the hospital. It's just a courtesy check. It's also like a great time to just talk about everything and get a feel for where these people are in their journey of taking care of this mom who had a baby and a new family. I would say, again, it doesn't some great opportunities. There's a national organization called Mocha Moms, if you're not familiar with it. It started in DC and Maryland area, so that's why I kind of know about it, but they're a national organization. They have chapters all over the country. They're a great organization. Join a chapter, and it's full of melanated moms, mocha moms, that kind of get together in a social aspect. But we do, whenever anyone and I'm in the Howard County chapter, we have 100 members, and anytime anyone has a baby, we automatically put up who's going to do the food. So everybody gets a day. You either mail them a gift card or you make them whatever dish that you feel is appropriate, and then we fill them up with plenty of food options for their postpartum ride. One of my friends, she was having like her second baby, and they were pretty close together, so she really didn't need any more baby stuff. So that was what the baby shower part was. Instead of baby gifts, she just got a bunch of gift cards to food services locally, Grubhub, DoorDash, whatever, so that she could order food and have it ready quicker than, because of course there's no time to cook. My other friend would make, this was a great idea. She would make gift baskets with snacks. So every postpartum mom got a basket of all her favorite snacks, and it would like literally sit in her bedroom. So that in the middle of the night, she had something to kind of munch on to kind of get her a little bit more energy, because she was breastfeeding, and that really helped her. So those are just some small tips of things that I think really can go a long way. If you're comfortable, if you know anyone one of my friends, she's a nurse. There are some organizations that are, nurses that do have pay for service where the nurse comes to your house. Some doula services will do that as well. Will offer to watch your young baby for you while you take a nap, while you exercise, while you meditate, while you do whatever you feel you need to do in that moment to get your energy and strength back. If you are a person like myself who does have a significant other of the male species, who, God bless their hearts, they mean well when they do, but they may not always know how to help. So I would give him very specific instructions of what to do to kind of make it a little bit easier. So at 10 o'clock, I went to bed. There was some breast milk on the counter. He got the 3 o'clock feeding because he's always awake at 3 o'clock anyway. And then at 6 o'clock a.m., he brought me the baby back. So I at least got a good stretch of sleep. And that was kind of like a routine that we fell into as well.
I think that's really helpful. I'm going to go into the question that's actually in the QA. I really don't feel there's a lot of space or welcoming space for fathers to hear how they can be involved and how they can contribute to giving relief, right? Or being a team with you. Right. So in the chat, in the Q&A, we have a question that says, what are some clinical, non-clinical ways that men can advocate in high-risk pregnancies, postpartum hemorrhage scenarios?
So great. So take the sheet. I just printed it off here just so everyone knows, like maternal, if you can see the urgent maternal warning signs, take this sheet, print it out, and post it on the refrigerator so that everyone can look at it and see, look, if she's, and ask her the questions, right? So, you know, when you got to give people a little bit of instruction, say, hey, you have to ask me because we women, we will suffer in silence for a very long time. So a lot of my patients, I thought the headache would go away. I thought it was getting better and their blood pressure's through the roof, and no one in their village or circle, because their doctor didn't call them, you know, they may or may not have had access to doulas, because unfortunately they're not accessed all over the country. No one knew. So we put this on the refrigerator, and the husband say, hey, do you have a fever? How are you feeling? And he would like kind of go back and forth so he could be involved in the process. Another dad, he was proud, he was on diaper duty. That was his thing. Mama's breast, he was a diaper. He changed the diapers all the time, probably more than he needed to, but hey, he's a clean baby. Who doesn't want a clean baby? So that's kind of other things that dads can do to definitely be involved. Laundry, dad is the job. And even if you have adolescent kids, their laundry duty, right? Even if they don't do everybody else's laundry, they'll probably do the baby laundry because that's kind of fun. So here's the hamper. Your 14-year-old, when it gets up to here, that's your job. You go do the laundry. And someone made a comment about, I think, about outsourcing. If you can, it can get expensive. Babies are expensive. So you can't always outsource everything, but that's a good gift to give a new mom who doesn't need baby things. There's maid services all over the country. Have the maid service come in for a month if that's something you want that you're willing to have into your home as well. But outsourcing anything that you possibly can. I feel like the meals, the housekeeping, and the laundry are the two biggest things that really can help.
And I love this. I love conversations like this where you get to think inside and outside the box, right? So what you traditionally think that you may need, and then when the baby gets here, you may have a completely different list of things, right? Because things change, right? If this is your first baby or if this is your fifth baby, there are always going to be shifts and things that your whole family is going to experience when welcoming this new little person, right? So having the right levels of support where you need it, when you need it, is super essential.
And we as women tend to be a little too hard on ourselves. Like, give yourself space and time and grace. Like Jay just said, whether you've had one baby or 8 babies, God bless you if you have 8 children. I don't know how you did it. But however many you have, it's an adjustment either way. So give yourself and your time and your space to change. You don't have to have everything perfectly ironed and before the baby's even born. It's very nice. I love the Pinterest and the Instagram pictures just as much as everybody else does, but that is not everybody's reality. And that's definitely not even my reality. There is a good pile of laundry sitting upstairs waiting for somebody to fold it. So give yourself some grace. What's out there on social media is often not reflective of the everyday normal life of any one of us.
It's true. It's true. And I think that's really important to point out, especially now during Black Maternal Health Week, right? When we think of health, we typically only think of our physical health or even our mental health now, right? But there's so many other dimensions of health and wellness that really pour into who we are and how we process being in that 4th trimester, right? So having these conversations, again, including our partners and our other family or friends as a part of that village, that's going to help keep other things balanced, right?
And I want to give one shout out to Miss Kimberly Harper. I don't know what your title is, I apologize, but the 4th Trimester Project by UNC, University of North Carolina Capital Region, is a great website. It's called New Mom Health. Great tips and trips. They have a whole website dedicated to the 4th trimester. It's a great project. Please reach out to them for any resources for either you, family, friends, or on a professional level. Thank you, Kimberly, for all the work you guys do out there.
That's amazing. Okay, I'm going to ask a little tough question here. What are some common challenges new parents face during the 4th trimester, and how can a well-designed plan help them to navigate those challenges?
Right. So we talked about some of these things are the warning signs that moms will have, as well as a little bit, I'll just briefly discuss, there are warning signs for the baby as well that you should go to your pediatrician with, and they should definitely talk to you about the warning signs of a newborn baby, which is very challenging in itself. The point I really want to make is that in the 4th trimester, this should be on your refrigerator. This should be in everybody's phone. Everybody knows what the emergency line is for the doctor's office. Everybody, it's on the refrigerator. Everybody knows the pediatrician's phone number. Everybody knows that, you know, our neighbor down the road, she's retired, she doesn't really work. If we need her, we can call her in an emergency. Those things should be written somewhere. Any medications, take a picture of the bottles of medications and have it in your phone. Save it as a favorite picture so that if anything happens, you can go to someone and say, these are the medications that he's taking or she's taking, or whatever the case may be. And if you really can do it, you put a little bit about any medical problems or surgical problems. So it's on your phone in one little note document that you can easily access. I think that's the hardest part. People get frustrated, you know, in these emergent situations and they can't really think about these things, which is totally common. But if you can, in this day and age, use technology to your advantage. If you're calling your insurance company, say, hey, I'm pregnant. What's the nurse pregnant line? What's the after hours line? Who can I call if in the event I have an emergency?
Right.
Those are things that you can acutely do for the 4th trimester plan.
Okay.
To make it well designed, write it down, to just have it, you know, kind of out there.
Okay. So I know we've talked about partnered patients or individuals, but can you talk about some unique needs for different families, including single parents, LGBT plus families, families with multiples, or even special needs children?
Absolutely. So single parents, it can be very challenging because there is no off time. And that's one of the groups that really do need to figure out who else is in their village that may not look like a typical village. I know this can be a very, you know, sensitive topic, but just because you may not live in the house with the person who you made the baby with doesn't mean they can't participate, you know. And I try, and again, this is a very unique situation, but, you know, even if your relationship part didn't work out, that doesn't mean that you can't co-parent in a way that's helpful. And of course, there's exceptions to every rule, and I don't want to make anyone uncomfortable,
Sure.
But it is something to consider, right? If someone can take the baby for 2 to 4 hours on a Saturday just to give you a brief time, accept the help, right? If hey, I need 100 diapers, you know, Kmart, Walmart, not Kmart, Kmart's not business, showing my age. Walmart, Amazon has it. Could you please buy? This is all I need. Say what you need. Don't be afraid to ask for what you need. Okay. But if you don't ask, you'll never get it. I find this very difficult when some moms come, he won't help. I was like, well, what did you ask for? I didn't ask him. He's supposed to help, but he doesn't know what to do, right? It's an awkward situation. Give very specific things that you need. I need Infamil formula, 32 ounces in the can at the store. Please buy 5 cans. Be as specific as you can. I guarantee you come in the house with 10 cans just because you asked for 5. You know, but be specific what you need. And that's for everyone. It even was challenging on a personal level from my mom. She didn't breastfeed, and I breastfed my first baby, and we were kind of going at it the first kid. But the second kid, she got on my breastfeeding game and she said, okay, I understand this now. I'm like, thanks, Mom. So, you know, it happens in different facilities. I say, but one of the challenges for LGBTQ families is, I'm not going to call them assumptions, but we do have to, as in healthcare, have to make some sort of connection, right? And I just want this community of people to sort of give us some grace, right? I'm not saying it's a new topic, but it's definitely more involved in the healthcare system as it should have been from years before. But, you know, mom and dad are terms that we use to address parents of a child. And if there's a specific term that we're using that it doesn't agree with your lifestyle, just let us know. Yeah. But please don't be mean to us. We don't mean to do this. We are, again, trying to find our footing in this world as we all are, right? Yeah. So example is older lady, she was a nurse, you know, she's calling in the waiting room and she's saying, Miss Jones, Miss Jones, Miss Jones. She called like 15 times. Finally, she's like, Miss Jones isn't here. And then she like went up to this woman who was sitting there and she goes, I don't go by Miss. And it was just like, so she could have missed her whole appointment because she was so turned off by Miss. But this nurse is like 65 years old. That world, it's not a part of her world. So, but then it kind of made the whole interaction just bad for Miss Jones, bad for the nurse. And then where do we go from here? Are you going to trust me with your information? No. So just I'd say, encourage the conversation in this group of patients. If there's some way we should address you, just let us know in a way. And most of us are very happy to accommodate, you know, mommy, daddy, whatever the situation is. I'm going through it on a personal, my cousin, she's in this community and she is trying to conceive and she's looking for an egg and a sperm and a donor. So we're going through all these things, and it's new to me because I've never had it on a personal level before, but just give us grace and keep the doors open. And again, find your village. Honestly, in this day and age on social media, you can find groups for almost anything. You definitely want to make sure that it's something safe that you want to invite into your world, because not everything on social media is safe, but I would encourage that as well.
Yeah.
I can't even touch upon multiples. Ooh. God bless.
Well, before you go on, I think it's great to hear you say to ask for grace, right? But also acknowledging if there is preferred language, opening up that door and that conversation with the provider is the best way, right? But I think that's also something that we should suggest to go into that fourth trimester plan of saying, how do we want to be addressed? How do we want to make sure that we're including your partner, whomever they are, however they identify? What are your preferred pronouns, right? How do we make sure that we're giving you the experience and including your family, however it looks, throughout this entire thing, right? So if there's ever a situation that comes up where your partner has to speak for you, you know, we just talked about all of these warning signs, right? We want to make sure that they're very aware of what's going on. They have access to the plan, right? So you both do those things together. Bring them in even with your prenatal appointments, right? So the medical provider and the group are acclimated to who is involved in that care, right? When I used to work in the clinic, I worked there for more than 10 years. And one of the things that we used to do was actually alternative insemination. And going through that process with families and learning, you know, how to do this journey with them, but then still seeing them go into healthcare, into hospitals that still stigmatize them, we had to provide them with the tools that they needed, not to, you know, excuse, you know, being like belittled or anything, but to use it as an educational moment to say like, hey, I want you to address me this way. I want you to address my partner this way. We are a part of this birthing experience, right? So it's not a contentious space, especially in birth. You do not want to go into the most vulnerable point in your life in contention, right? With people who literally have your life and your baby's life in their hands.
And ironically enough, it's not just isolated to this particular community, right? In a lot of Middle Eastern companies, the husband speaks for the wife. And in this country, I would say that's not typical. Let's just say it like that. So it creates a lot. And most of the nurses on labor and delivery or in this field are female. So it creates a lot of distinction when we're looking at the patient and she says nothing, but then the husband answers.
Right.
So that's a whole nother dynamic that we have to kind of work together to figure out what's the best way to acknowledge the husband's role in his wife's life, which is very, very intimate, and still understanding where she's coming from, how she's feeling and what's going on with her. And we actually had a bad experience where the husband, he wouldn't bring her back to there's nothing we could do. He's like, I'm not coming, I'm not bringing her back here. And we were like, okay, thank you. Hope you guys are okay.
That's interesting. So I think it was last week, so Melanated Moms has a virtual support group called Melanated Mommy Talks. And we actually did one last week with a Muslim-based doula collaborative. And we asked, you know, how do we understand the best way to support families across different cultural or religious or spiritual backgrounds that may not align with our own? And it was such a great conversation just to hear the way that, just like you were saying, like understanding like their husband speaking for them is not out of duress, you know, this is what we prefer. This is a part of our culture. But having a provider that's open to that and understands these dynamics is key for those doulas, right? So they are going into spaces supporting this mom, supporting the father, but also being that liaison between the clinical and the holistic space of saying, here's how we're going to make sure that this person gets the birth experience they need, but this is how I want you to also recognize how important their culture is to this whole experience, right? So to your point, Western culture isn't about a man speaking for a woman, right? It's usually the woman she's speaking for herself, or she's there by herself, or whatever. But knowing that everybody's family is different, right? So being open to it, being aware of it, and also extending yourself and them grace as you're learning to go through it together. I think that's so important in the work that we're doing. All right, sorry, kind of getting off track there. So I know we touched on, or we were about to touch on multiples and special needs children. Do you have any particular advice in that area for the 4th trimester plan?
Right. So that's a very specific plan. And I think those families, unfortunately, they kind of need to start planning like in like the 2nd trimester. Like you really need to, because you have so many needs, and special needs children, usually they need multiple doctor's appointments. So, and they need to be seen very early in the course of their development. And that can be very burdensome for families, especially for a mom who's still trying to recover. So having someone who's just having another human being, I think one thing that's stressful about a mom is knowing the past medical history, past surgical history, social history, allergies, medications of all your children, no matter how many you have, when is their doctor's appointment? What do they like? That's a lot, right? So then to add that for a special needs child, it's even more intense. So to be able to have someone in your village who understands the needs of your child very specifically, because special needs children often have very little nuances that nobody would know to ask, but because you take care of them, and being aware of them, and then making other caregivers aware of them as well, I think will help take the burden off of those families. And also even having guides, like written guides, how to take care of my child, what my child's special needs are, and how we found ways to, help your child cope with them. That's kind of a big ticket. And then honestly, if you have more than one baby at a time, you just need a bigger village, because you need like 2 of everything or 3 of everything. God bless you if that's the case. The downside with multiples is you have a higher chance, as most of us birth workers know, of delivering prematurely. So it happens very unexpectedly, right? So I feel like sometimes, my mom, and this is true with my moms with, 1 child versus multiples, it's like, oh, I can do everything and anything I've ever wanted to do. Don't let pregnancy stop me. And it's like, let's take a time out with that.
Take a breath.
This is a special miracle or miracles that you are carrying. And no, you cannot climb Mount Everest. No, you cannot run 20 miles if you've never done it before. And it's okay that you can't do it, but let's talk about the goal of this is develop happy, healthy children. So this is with the 4th trimester as well as the 3rd trimester. You want to talk to your healthcare providers about when is it safe to travel? Where can I go that is considered safe to travel? What should I prepare for when I do travel? Kind of incorporating all those things, especially with multiples and preterm birth and the 4th trimester plan. Like you don't want to be taking your brand new baby. No one, just send pictures, okay? Just don't know. Babies have their immune systems are extremely weak. Babies and elderly people have like the same level of immune system, right? It's just not strong enough to mount against germs. So protecting your family, protecting who comes in your house is also part of your 4th trimester plan. Like just video chat. Everybody can hold the baby. Here's the baby, and then when your baby's had his first rounds of shots and the pediatrician is like, okay, usually that's like the 6 to 8 week mark. Then, okay, we can start letting more people into our village. But that's another point in time. It's not the size of your village that matters. It's really the quality.
Yes. Thank you for saying that. Quality over quantity every time.
Right.
Every time.
Right. And saying no. Sometimes you have to say no. That's another point. This is your village, your protection, very sacred part of your time. And if you're blessed enough to be off of work for any prolonged time, enjoy these moments, because if everyone knows on this call who's ever had a child in your life, you turn around and they're not even the same human being anymore. So it goes by so quickly. So treasure the time that you do have. And if it means, you have to say, no, I don't want to visit her right now. Thank you so much for thinking of me, but I can't see you right now. Thank you so much, but me and my baby are not available. That is completely acceptable. And it's what you need to do to keep your peace, then do it.
Yes. Keep your peace. Oh my gosh. Okay, I'm going to jump to the question in the Q&A really quick. So Malcolm asks, what are some ways to address biases in the classroom with peers when in medical or nursing school? That's a really good question.
All right, we can go. That's a little off topic, but we can go in there. So, I mean, that's a hard one. I mean, in general, we all have biases. That's how we exist as humans. It's just natural part of every day. There's nothing wrong with having a bias. Is when that bias changes your behavior towards that person. That is when your bias becomes, inappropriate, in my personal opinion. So, and and it depends on who is being biased to you. Is it like another student or is it your professor? Then it gets kind of tricky. Right. So most medical schools or nursing programs have an avenue for some sort of complaints. Most of the time you have a mentor or a guide or a teacher. That's the first person who you should contact with. Most institutions by law, I think, that teach have to have some sort of avenue for you to go to, like a counseling department or like like HR for class or for school. I don't know. It's been so long since I've been in school. I don't remember the name of the department, but it does exist. So that would be, if you can't, if your immediate needs aren't being met by that professor or mentor or advisor that you're assigned to, then that's the next step to go. If you're handling it yourself, can be challenging, especially if you haven't quite found your voice yet. But it's very often, nursing medical school is very overwhelming. You feel like a little bitty fish in a big old pond. So you may not have the words. I could do it now because I'm older and I'm out of school. Even still, I get in trouble, believe it or not. But I would say those are the avenues. And also, you want to make a note if you're going to make a complaint, not a complaint, but bring up a concern. At the moment the incident happens, if that incident offends you, write down the date, the time, when the incident took place, and the conversation, and who was around. Those are specific facts that need to be documented according to what your complaint. So you can't just go and say, oh, last week, Susie said this to me and I was offended. That's not really enough, right? It needs to be specifically what she said, the date and time and place she said it, and who was all around that heard it. That gives your complaint more strength to be heard, and that something potentially could be done. I apologize if that happened to you or any of you, as I'm sure it has to all of us. I just hope you just keep going and know that everything you're doing is for the good of other people.
Thank you so much for that. And I think that kind of wraps us back to the advocacy piece, right? So understanding how important it is to advocate for yourselves, and how that also can create more space for your classmates or other people that you're in school with, to know that it's a safe space and it's a safe place for them to ask for the support that they need, or to point out these things if that's causing inequities in your educational experience, right? Same for me. I've been a nurse almost 20 years, so I know years and years and years ago, sitting in a classroom and hearing certain things and wondering, like, where did they get this statistic from? This isn't a reflection of who I am, right? And I always would think about, if this is what they're teaching in terms of, if you deal with a Black patient and they have this, excuse me, as a Black person, I'm like, that's actually not true, right? But understanding that this is setting a foundation for the way that the next level of nursing or the next level of medical care is going to be delivered, we have to speak up. We have to say something. You can push back, right? So not necessarily saying you have to burn the building down, right? But like, push the envelope and say, like, listen, I really would love us to have more of an open dialogue, so we don't create stereotypes where when it comes to like providing patient care, right? So for us at Melanated Moms, the 4 things we always want to focus on whenever we're providing any care, whenever we're referring anyone or doing any workshops, we look at race, we look at ethnicity, we look at culture, and we look at language. We understand that those 4 things can make or break anybody's experience, right? So if I don't know how to literally or figuratively speak your language, we won't understand each other. We won't have communication. If I don't know how much your culture impacts the way that you live, eat, play, or work, then we can't connect, right? If I don't know how your ethnicity and your race impacts the other parts of your life, then you'll find more of our differences as opposed to our similarities in order for us to stay connected and be engaged, right? So when it comes to supporting families, when it comes to being a village, creating a village, we have to look at all of these parts of who we are and who the person who's giving birth, who they are and what they're experiencing, in order to pour into them the right resources that they need to get through it, right? Birth is a hard thing. It's a hard thing to do. But the accomplishment is not just the physical birth, right? It's understanding how all of these things encompass who that person has become, and who the people around them will also become, right? Because that little baby is not just a product of that one person, right? This little baby is uniting a completely different community or in village, right? So having conversations like this, being able to meet you, Dr. Medlock, it's really so refreshing to be able to see someone who looks like me, to see someone who understands how to navigate a clinical space, and also understand from your own personal experience how critical it is to have a village support you. I'm so grateful for having this opportunity. Did you have any other words? I want to be mindful of our time. Did you have any last words or things that you want to share?
I want to thank all the people that participated in this. I hope you guys have learned some quick tips and things that you can take back to your areas. I saw there was people, someone from Washington, Georgia, North Carolina. I praise all of you for all the work you do all over the country. We only have one goal, and that is happy, healthy mommies, happy, healthy babies, and happy, healthy villages together, whatever that looks like. I do want to encourage you guys to keep up the good fight. You're doing good work and don't give up. And also, I do one point of contention. I want all of us to try our best as a healthcare profession. This drives me crazy. Please tell your patients what hospital to go to that they're supposed to have their babies at. Like, I feel like I'm like beating my head against the wall, and I'm in Maryland, right? So there's like multiple different hospitals you can go to, be it a good thing or a bad thing. And these patients are getting so lost in the crossroads of this hospital, that hospital, records, like no one understands this concept. So I really want to encourage all of us as healthcare. Look, this is where you're supposed to go to have your baby. If you can get there, great. If you can't, fine, but you have to communicate with someone who you see in the outpatient world, where you were, where you went, and how you're going to get back to where you're supposed to be. OBGYN obstetrics is one of the very few fields left in medicine where we, the providers, take care of you in the inpatient world and the outpatient world. And if the best outcomes are when the two meet together. That creates the best outcomes for moms and babies. And unfortunately, in our healthcare system, that's getting lost for many reasons, most of it out of anybody's control, us, the healthcare workers, or the patients. Patients move around, people move around. Doctors, nurses change jobs, hospital systems change their demographics. How many OB units have been shut down simply because of it? It takes a whole lot of money to insure an obstetrics unit, a labor and delivery unit hospital, and a lot of hospitals don't have resources to do that. So please help your patients navigate that part of the healthcare system. We're taking you care here. This is the hospital we're affiliated with it. This is who we know, and this is where you have to go in order to get best outcomes.
Absolutely. Thank you so much. This has been such a great conversation. I really hope that everyone found some great gems, because you were dropping them this entire conversation. I hope that I'm actually in Silver Spring myself, so I would love to connect with you.
Oh, that's your house. Yes.
Come to my house. I'll make you mac and cheese.
Thank you.
But I definitely would love to stay connected. Again, thank you so much, Marie, for opening the space to us and giving us the ability to connect through your platform. And I hope that this was as impactful as it was for us. Okay. If there are any other questions, please make sure send them through email and we can definitely answer them. And I hope you all have a great night.
Okay, Marie, did you want to say anything?
You guys are so sweet. I always feel like I'm God when I have this distended voice. I guess I hate turning on the camera because it messes up the recording. But I do so appreciate both of you for doing this on a Friday night. And this was so amazing. Thank you, thank you, thank you. We will provide contact information when we share the recording. We do have, and we captured the additional resources that were mentioned. We'll put that on our website under resources. And we'll share the link in the email that we send out with the recording. We will include Jay's organization and links to catch up with her and her group. And thank you both. Just wonderful. I've
Thank
liked
you.
the little dance, the Holy Ghost dance. This was exactly what we envisioned.
Thank you so much. All right,
Thank you,
everybody have a
guys.
great night.
Thank
Have
you
a
so
great
much. Reach
night.
out if anyone has any other questions or concerns.
All right, take care.
Take care.
Thank you.
Bye.